So these videos were not necessarily intended to be educational lectures, but they were intended to be more of how the education and the knowledge of human behavior can be applied to the things that were already being done within a cultural perspective or an indigenous living perspective. It was to show the everyday person, and not necessarily the therapist, but show the everyday person how they could benefit from both, because both have merits to them. As much as psychology was developed by people who were not necessarily of African descent and didn't always understand the way of Africans, sometimes being labeled as primitive, it was also a thing that there was truth or some truth in the basis of the things that they observed and the conclusions that they came to, and how even the therapist you're going to find, the basis of their knowledge is based on that, but how that knowledge then morphed and grew in the context of living in South Africa and working with South Africans and studying in South Africa and being raised in South Africa, that made such a big difference to how they approach it. So this was more of an advocacy. I'm a self-appointed advocacy. Before but I'm a self-appointed advocate of mental health, and part of this is also embracing psychology, even though we may feel that it's fallen behind or is not moving as quickly as it should be towards accommodating a more cultural paradigm, or working from a more cultural perspective. So in looking at some of the research